What's going on, everyone? Jeremy here from the Recording. A little bit of a different video today. This was by far and away the most requested topic on Twitter. Before I made the video, I thought, this is one that's probably not going to appeal to a lot of my viewers, but here I am. I listen to you if you follow me on Twitter at the Quartering. I take suggestions every morning, and hopefully if you're one of the minority of people that are interested in this video, that you'll leave a like, a comment, and consider sharing it on Twitter, because there's a lot of information and misinformation going on right now with the coronavirus, mostly on Twitter and many news websites. And before I get into breaking everything down, I think it's important to understand perspective here. Why is there this specter around the corona and not everything else in terms of, oh my God, the world's going to end? Well, I think if you look at where it's originated and the secrecy of their government, that's obviously a big part of it. Do I believe that China is vastly underreporting the number of cases? Yes, I do. Do I believe that it was, because of where it was originated, there's some sort of factory there, some, weapons factory? Did they do it? I don't know. Anything's possible, but I think the level of hysteria around this is, I think, first and foremost because of where it's generated and the amount of misinformation just that the Chinese government is permitted to put out to the world. They're a nation that is allowed to pollute more than any other nation because of money. If you use Twitter, there's obviously a ton of shocking video clips of things going on. As of this morning, the CDC is investigating dozens of potential new patients across 22 states in the United States. It's here. Now, to provide some perspective, first, let me tell you what's going on with it. So this, according to some, I think this originated out of the CDC, it's actually a large group of viruses that are common among animals. In rare cases, they are what scientists call zoonotic, meaning they can be transmitted from animals to humans, which is where a lot of the memes around bat soup and everything else came to be. Now, I don't know whether or not it's bats that did this, but Twitter is Twitter, and they talk about, oh, this is where it came from. Well, I don't think anyone really knows. The virus can make people sick, usually with a mild to moderate upper respiratory tract illness similar to the common cold. You get a runny nose, headache, cough, sore throat, fever, and a feeling of being unwell. For those with weakened immune systems, the elderly, and the very young, there's a chance the virus could cause lower and much more serious respiratory tract illness like pneumonia or bronchitis. Spreads in the air by coughing, sneezing, personal contact, such as touching or shaking hands, touching an object on a surface, rarely in some other cases. Now, what does this mean? Wash your hands, wash your butt. Take care of yourself just like any other flu. Put things in perspective. You can see, according to the CDC, this year's flu season led to 5.9 million medical visits, 120,000 hospitalizations, and between 6,600 and 17,000 flu-related deletions from October 1st, 2019 to January 11th. That's in 3 months. 17,000. The coronavirus is currently linked to 26. All right. I don't want to poo-poo it, because you see stuff like this where there's just videos of people standing there and just, I don't know what happens there. Or this one. Somebody in the street collapsed too. Is this mass panic? I don't know. Here's another one. Right? Now, we don't know, first of all and foremost, we have no idea when these videos were taken. We have no idea if these people are in fact carrying that particular virus. I think it's safe. I think it's understandable to assume that, but we don't know that. You could see the CDC and prevention said Friday it had confirmed a second case in the U.S. of the coronavirus from China and is investigating dozens of potential patients across 22 states who have shown signs of pneumonia-like illness. This is the news cycle, everybody. Remember, wash your hands, take care of yourself, use hand wash, antibiotic stuff. Why can't I think of it? You know what I'm talking about. The alcohol stuff. Purell. Use that. And for the vast majority of people, this is not what the media is hyping it up to be. Could it turn out to be that way? Sure. Do I believe China is lying? Absolutely. When we look at millions of people being quarantined right now, it's hard to imagine that they could look at it and say, I mean, I'm not talking 1 or 2 million. I think the number is as high as 40 million now. We also see China rushes to build new hospital in 10 days. They're basically building a field hospital. China's rushing to build a new hospital in staggering 10 days to treat patients at the epicenter of this outbreak. It has stricken hundreds of people, state media reports say. The facility in central Wuhan is expected to be in use by February 3rd to serve the rising number of patients infected that has left at least 26 people dead and millions on lockdown. Dozens of excavators and trucks were filmed working on the site by state broadcast CCTV. It will have a capacity of 1,000 beds and spread over 25,000 square meters. Construction began as reports surfaced of bed shortages in hospitals designated to deal with the outbreak, which has now infected 830 people across China. Let me be very clear, this number is in the many thousands. I would be willing to bet that this number is in the many tens of thousands. However, again, we haven't seen any data to indicate that this particular virus is worse than even our normal flu outbreaks. So I want people to I think it's important to understand what's going on. It's important to understand and call out when people are spreading misinformation, and when the World Health Organization this morning indicates that it's too early to declare this as a global emergency. Now, are they basing that on information from China that is full of lies? We don't know. Right now, they've got 25 perished, 800 affected. I don't believe it's only 800. I believe it's in the many thousands. That's as far as right now I think I'm willing to go down the rabbit hole. I think certainly people are looking at the way they're getting treated. Quarantined, they're probably not as likely to declare themselves as being sick. They're likely to keep this to themselves. I think that when we look at the symptoms, it's not necessarily any different than the normal cold or flu. And how would a normal person know the difference? It's not like you have like a beer bottle shape like thing that you can see that happens on your skin, so you know. And you can see their official statement. I'm not declaring this outbreak a public emergency of international concern today. The emergency committee was divided over whether or not the outbreak represents as a PHEIC. This is an emergency in China, but it has not become a global emergency yet. Well, it's in many nations right now. Many, many, many countries. They go on to say, this should not be taken as a sign that the WHO does not think the situation is serious. It's following this outbreak every minute of every day at country, regional, and global level. I will not hesitate to reconvene the committee at a moment's notice if needed. I thank China for its cooperation and transparency. This is the statement that's a concern to me. I'd be willing, I'd be willing to bet a lot of people look at this, you could say, if the mortality rate is so low and influenza so much higher, why are 4 cities quarantined? That's exactly what a lot of people are asking. You know, they want to know what is going on here. You know, do we believe that they're telling us the truth? I don't believe so. But we only have the information that we have. Again, we see videos like this surfacing, but we have no idea when this was even taken, what this person had. When you're talking about a country of, look at the United States alone, there are probably videos of people collapsing right now. I think that you're wise to be skeptical, but you're also, I think, better served understanding the truth of it, understanding how it compares to everything else, and understanding that news is going to news. They've got to fill that time slot with all sorts of things that keep you scared and afraid. It's because that's what they do. That's how they control what you're doing. They want you to sit and watch the TV on bated breath for them to tell you about the new scary thing. I showed you earlier what real numbers are from just the standard flu, and this hasn't indicated in any way, shape, or form to be any worse than that right now. You can see, you have the Daily Mail covering universities on alert amid global panic. And colleges across the UK are taking urgent measures to safeguard students and staff as it emerges 120,000 Chinese youngsters are studying there. Again, it's really only relevant if they were in China recently. I mean, this is the kind of panic that I don't like. And then you see people using it to push their agendas, eat the bat bigot. We see this. Ooh, your headline is phobic because it says, there's Chinese people there. I mean, it's a bad headline, but what the implication is probably there's a high likelihood that some of them have traveled home in the recent couple of weeks. Just a bad headline, nothing intentional. I think it's important to keep an eye on this, but I also think it's important to live your life, do what you normally do, keep yourself clean, stay away from people who are sick, and I think, hopefully, everyone will be all right. I hope you enjoyed this video. We'll talk to you again real soon.